Hi everyone, I'm Dr. Scott, your friendly neighborhood dentist. Welcome to my YouTube channel. In this series, I'll be touching on different types of mouthwash. Before we start, do you know that our ancestors used the Portuguese urine, tortoise blood, mixtures of berries, mint leaves, and vinegar or wine as mouthwash until a guy discovered that alcohol could immobilize and kill bacteria. Alcohol then becomes the most popular ingredient used in the mouthwash until today. So mouthwash cannot replace the daily brushing and flossing, but it may be a helpful addition to the daily oral hygiene for some people. So broadly speaking, there are two types of mouthwashes, which is the cosmetic mouthwash and the therapeutic mouthwash. Cosmetic mouthwash may temporarily control the bad breath and leave behind a pleasant taste, but it doesn't kill bacteria, prevent decay, or whiten teeth. Whereas the therapeutic mouthwash, by contrast, has some active ingredients to help to control or reduce conditions like bad breath, gingivitis, plaque, and even tooth decay. And the active ingredient that may be used in the mouthwash include cetapyridium chloride, chlorhexidine, essential oils, fluoride, peroxide, and even lidocaine. So here are some recommendations on the usage of different mouth rinse for different oral conditions. So number first is dry socket, or we call it alveolar osteitis. So if you are having a dry socket 2 to 3 days after extraction, so a recent study comparing 18 trials has shown that the chlorhexidine to be effective for dry socket prevention following the wisdom tooth removal. So breakdown of food, dental plaque, or even bacteria are the common sources that produce volatile sulfur, or we call it the VSC, which leads to bad breath. The cosmetic mouthwash can temporarily mask the bad breath and provide a pleasing flavor, but antimicrobial formulation in the mouthwash like chlorhexidine, cetapyridium chloride, and essential oils will have the antibacterial effect and have long-term control of the bacteria, hence reducing bad breath. Next is the plaque and gingivitis. Some studies found that the chlorhexidine mouthwash achieved better plaque control than the essential oils. However, no difference was observed with respect to gingivitis control. However, the cetapyridium chloride and chlorhexidine may cause brown stains of teeth, tongue, and dental fillings. And certain mouth rinse contains the fluoride ions can promote remineralization for your teeth. So a Cochrane systematic review found that the regular use of fluoride mouthwash reduced tooth decay in children, regardless of exposure to other sources of fluoride, like fluoridated water or fluoridated toothpaste. And if you are having pain due to ulcers or wound in the mouth, then mouthwashes contain the topical local anesthetic, like the 0.15% benzidamine hydrochloride mouth rinse, or even the sodium hyaluronic and glycyrrhetinic acid, which may help to relieve your pain due to the ulcers. And mouthwashes that claim to whiten teeth also contain 10% of carbamide peroxide or 1.5 to 2% of hydrogen peroxide. And one study found that 12 weeks use of the mouthwash containing hydrogen peroxide in this concentration range achieved a similar color change as that achieved by 2 weeks use of 10% carbamide peroxide whitening gel. And if you have dry mouth, you're at higher risk of getting more decays. So a fluoride containing mouthwash might be helpful to those managing this condition. However, since the alcohol can be drying, it's advisable to use an alcohol-free mouthwash. So here are some reminders for you to use the mouthwash when prescribed by your dentist. Use them as directed by your dentist in terms of dose, frequency, and time in the mouth. If the dose is missed, use the rinse as soon as possible. Doubling the dose will not have any therapeutic effect. And lastly, you may want to look out for the ADA seal on the mouth rinse, because the mouth rinse with ADA seal will have proven safety and effectiveness for everyone. And that's all for today. Hope the information above helps you in some way. If you feel this video is useful, please subscribe, like and share this video with your families and friends for more upcoming dental videos. And if you have any questions, please drop by in the comment box below. Thank you and see you in my next episode.